Welcome to our 2011 Quality Symposium. I'm so very pleased to see such a large crowd out today, to see so many familiar faces, both from within our LHIN and from around the province. For those of you that don't know me, I'm Mike Barrett. I'm the CEO for the Southwest LHIN. We're very pleased to have you all here today. And just in circulating around, I've heard lots of positive comments about the day and what we have planned. We're very pleased that we can offer this program to talk about quality and innovation. And your response, your reaction to come in large numbers today is well above our expectations, so I'm confident that we'll deliver on a good program. And we do have a great day planned. We have our 3 keynote speakers with Jim Easton, Stephen Lewis, Minister Deb Matthews, together with Dr. Sharp and Dr. Lisa talking about critical care, my colleague Camille Orridge talking about the successes from the Toronto Central LHIN, our Partnerships for Health panel, and our governance panel tonight. We have a great lineup, and our guests will have a more complete introduction when they're introduced to the stage throughout the day. I just want to set the current context for the environment that we're in today. The current financial position of the province is concerning. We've got a $16.7 billion deficit this year, a deficit which we won't escape from until 2017, 2018. So that deficit is going to continue on a yearly basis. But in the midst of that deficit, we're still seeing increases to health. We're still seeing increases to education. This is the government's commitment to those sectors. But unfortunately, these increases are at the expense of some of our other public services. You read the report from David Dodge, who's the former governor of the Bank of Canada, who released his report through the C.D. Howe Institute on the sustainability of healthcare funding, and he actually provided 4 choices of how we can proceed. 4 very unpalatable choices, which suggest a reduction in other public services, increased taxes, increased individualized spending through co-payments, longer queues, and services of poorer quality. Now, I don't necessarily agree that those are the only 4 options that are available, but it is a warning that we do need to heed. We do need to change the way that we are doing business. Quality improvement research, which we're talking about today, has shown that poor quality is more costly. Hospital-acquired infections, adverse drug events, patients with chronic diseases that are not always receiving the optimal care required, and the cost of avoidable emergency admissions is high. But you will also hear today that quality improvement initiatives can reduce costs. To do this, it does require careful planning, leadership and expertise, and a sustained and relentless focus on high-quality implementation. And if you look around any industry within the economy today, whether it's cars, appliances, or other products, everyone's focused on quality. But the difference in our business is we're focused on people. These are your children, your parents, your grandparents, our spouses, siblings, friends, and neighbors. Our business is different than what exists within the other businesses within the economy. So, since the last time we came together, that was back in 2008, it was part of our engagement session associated with our health system design blueprint. Our blueprint's now complete, and we're working on the achievement of our blueprint vision of a single unified health system of care. This is where the system works together across sectors, across geography, as one complete system. We've had great successes, and some of the successes are noted on the screen with progress with seniors and adults with complex needs, mental health and addictions, chronic disease prevention and management, and coordination across acute care services. You're going to hear about some of those success stories today to see the advancements that we've made since we last came together. We also have our Health System Leadership Council. The membership, you can look within the program guide. These are leaders from across the Southwest LHIN, from across geography again, from across different sectors. These leaders help us provide advice. They provide advice to us as staff at the Southwest LHIN board, but also to our board of directors in the decision-making process for the very complex and difficult decisions that our board needs to make. We also have several new board members, and I'd just like to acknowledge them today. If you could stand up briefly, and then we can acknowledge them when they're all standing at one time. Our new board chair, Jeff Lowe. Our vice chair, Linda Stevenson. Carrie Blograve. Is Carrie here yet? He's coming. Carrie is one of our board members from Listowel. Ron Bolton from St. Mary's. Ron Lipsett from Annan, which is in Grey County. Ron. Janet McEwen. I'm not sure if I've seen Janet yet. And we also have two other board members that are not here, Murray Bryant and Cheryl Fagan. So I'd like to recognize our board members. 3 of our board members are stepping down in the next 2 months. That includes Murray, Bryant, Janet McEwen, and Carrie Blograve. But we're fortunate that we have 3 new board members coming in to replace them. So I'd just like to set the stage. Probably everyone in this room has heard or read in the media that LHINs are an unnecessary layer of bureaucracy. You read the paper, you look at the news releases, it's in there on a fairly regular basis. The London Chamber of Commerce, in this article, which is on the screen, which I'll refer to, they actually submitted a report to the government, a pre-budget consultation report, with a number of recommendations for the budget. Those 2 recommendations, or the 2 recommendations that related to health, were to hold the line on spending and to get rid of LHINs. This did not make the Minister of Health very happy. She felt that the Chamber didn't give a fair shake to the LHIN, and she requested a meeting between us, her, and the London Chamber of Commerce. So we met with the CEO and the board chair of the London Chamber of Commerce about a month ago, and they indicated to us, well, we didn't really do any analysis or review of why we thought we'd get rid of LHINs. We just felt that they were an unnecessary layer of bureaucracy. And he said, I'm sure you're here today to tell us that you're great, and I want you to sit there, or I want you to go ahead and prove it. Points the finger at our board chair, Jeff Lowe, and I. So we went through a presentation, talked to them about less bureaucracy with LHINs, more accountability with our accountability agreements, local decision making, open public board meetings, and less big government. All things that the Chamber of Commerce espouses as an organization. By the end of the conversation, the CEO and the board chair both indicated that, geez, we should have done our research, and we do believe that there is value to LHINs. Unbeknownst to us, the next week in the London Free Press, the CEO actually submitted an article, a commentary, which is the one that's shown on the screen, showing that he said we have a strange name, but there's value in those LHINs. So we do have a communication problem. We will talk about communications today, how we can improve that, and getting the good news stories out. But all of you as leaders in the public sector, open yourselves to criticism each and every day. And as the system becomes more and more transparent, there's not much about our businesses that's not known to the public. So we're very open and transparent. We need to be able to weather the criticism that will be directed at us and continue to focus on the job that we need to do, ensuring that our patients, clients, and residents get good service, high quality service in the future. All of you will be familiar with the Excellent Care for All Act. It actually was released on the heels of our Blueprint in IHSP, and it actually aligns perfectly with the goals that we've identified within our Blueprint in IHSP. What that strategy means is that the patient, client, resident will be at the center of the healthcare system. Decisions about the patient, client, resident care are based on the best evidence and standards, and that we are focused on quality of care and best use of resources. And the main goal is to ensure that we get better and better at what we do. Right now, the Excellent Care for All Act is focused on hospitals with requirements for quality committees, quality improvement plans. That is going to roll out to other sectors across the province. The hospitals were the first sector to be involved, and now we're moving it across other areas. I'd also argue that the legislation is organizationally driven, so it's focused on individual organizations. We need to ensure that excellent care also focuses on system improvement. If you look at where we can have the greatest success in patient, client, resident, increases in satisfaction, quality, and safety, it's in those transition points between the different sectors. And that's where we can see the greatest improvement. All 14 LHINs have identified a number of interrelated initiatives that we are collectively implementing to improve quality and access. All of these initiatives will have a direct impact on ER wait times, alternate level of care, and the patient, client, resident experience. The Southwest LHIN is working with our partners, all of you, to implement these initiatives under the banner of Access to Care. You'll hear a lot more about Access to Care from us in the coming weeks and months, as well as hearing about it today. But that Access to Care banner includes a number of different components, one of which is Home First. The Home First, it's a philosophy to ensure that the ultimate destination for patients, residents, and clients is at home. It's not within a hospital, it's not within a long-term care. The ultimate destination should be home. And it's about a massive culture change that we need to undertake to ensure that everyone involved in the healthcare system, whether it's within the physicians in the hospital, nurses within the hospital, community providers, that we're actually changing that philosophy so that we're ensuring that patients are cared for close to home and in their own home. These are some of the projects or initiatives that we have ongoing with access to care. As I said, it's a basket of different services. Resource matching and referrals, senior-friendly hospitals, where we're doing an audit of all 154 hospitals across the province to see how friendly they are, senior-friendly they are. Home First, which I mentioned, falls prevention, working with our public health units to ensure that we've got programs in place to prevent falls for our frail seniors. We have a number of different quality improvement-based successes that we've achieved in the Southwest LHIN. Here's a list on the screen right now. It includes the Flow Collaborative, Partnerships for Health, Patient Access and Flow, MRI Access, where our MRI wait times have gone from 169 days across the Southwest LHIN 3 years ago to 69 days. We did that with a system approach, ensuring that the providers of that service are working together. ER and inpatient performance improvement programs, Residents First, which many of you in the long-term care sector certainly know about, Inspire, which allows hospitals to connect electronically with family physician offices. I often say in presentations to whatever organization I'm speaking to is that eHealth has the potential to, the greatest potential to improve healthcare within the province of Ontario. And we need to have a continued focus on that and ensure that the patient is at the center of that conversation. So just finally, as I said before, you'll hear today from Jim Easton about the need to relentlessly talk about the positive stories. So I started off saying what the current context is, some of the situation around the finances, but we need to talk about what are the positive stories within the Southwest LHIN across the province. So there's a number of ways we're going to do that today. First, you'll hear from our speakers, which I've mentioned already. We also have our roving reporter, Mike Stubbs. Mike, if he's sitting on the table back there. For those of you that don't know, Mike is the voice of radio on CJBK AM in London. He's also the voice of the London Knights. Today he's working on behalf of the LHIN, collecting some of your thoughts about quality and reactions to the presentations for a video vignette that the LHIN will put together about quality in the Southwest. So if you see Mike coming up, smile and talk to him about your organizations and the good things that you're doing. Secondly, during the lunch hour, I encourage each of you to visit our Showcase Alley, where we have a number of quality-related displays about activities underway in the Southwest. An overview of the displays is actually included in your program as well. One example that you'll see in Showcase Alley is the improvements that are being made to the healthline.ca, which includes the enhanced programs and services inventory as it goes live this week. All of the sessions today will also be videotaped, so you'll have the opportunity to look at these videotapes again on our website. And you may have heard us talk about this before, that we videotape practically everything because people say you need to communicate, so we are communicating. Our YouTube videos on our Southwest LHIN website last month were the 11th most watched YouTube videos for a nonprofit organization. These are basic videos with relatively cheap camera equipment, which has good people like our providers in the Southwest LHIN talking about the initiatives that they have ongoing, as well as the slide decks from today's presentations will be on our webpage as well. And we'd also like to welcome members of the media who may be joining us from time to time throughout the day and hopefully share some of the stories about our relentless quest for quality. And I hope that some of the stories that they hear today will allow us to bump off the federal politicians or William and Kate. No, that's probably a tall order today and tomorrow to bump off William and Kate, because that seems to be consuming a great deal of the media. But we need to get our good news stories out there, the good news stories about quality within the system. And finally, talk to your neighbors. You look at the wealth of expertise that we have in this room today, and you'll have time within the agenda to have that conversation. You have a room of over 500 people with success stories in their own organizations. Talk to them, learn from them, invite them to the next meeting of your leadership team, your board, to talk about their successes. And finally, before I pass it over to our moderator, Paula, for the day, I just want to indicate that we have a special announcement at the end of the day. Come 4 o'clock or so, when we wrap things up, we'll talk about a special announcement around quality and what we're doing. So I'm confident that working together, we can achieve our overall vision, the vision that's defined by our board, which is Southwest LHIN, a healthcare system that helps people stay healthy, delivers good care to them when they are sick, and will be there for their children and grandchildren. So again, thank you very much for coming today. I'm going to pass it over to Paula Blackstein-Hirsch. Paula is our moderator for today, and probably a lot of you know Paula. She's a senior regional director with the Canadian Patient Safety Institute, and she's going to lead us through the discussion today. Thanks very much.